you hear a general practitioner talking to a patient named Sarah Gleason. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at your notes. Sarah Gleason, come in, please, have a seat.
Hi, doctor. Thank you.
So, what can I help you with today?
Well, I'm a little worried because of a couple things, actually. I've been taking a combined oral contraceptive pill called Monofem to help me, well, for more regular periods. They've been a little crazy the last few months, so the last GP prescribed it for me. The first few weeks I thought I noticed something, like I just felt different somehow, a little off, but I thought it was just my body getting used to it. But it hasn't been getting any better, so I want to check that out. And the second thing is, well, I'm worried I may be pregnant.
Okay, well, look, let's start with how you've been feeling and then we'll move on to that because it will be helpful to establish the symptoms first. Can you describe those for me?
Well, the first thing I noticed was these really bad headaches. They kind of spread out all over, but they always start around my right eye, and they just seem to last for hours. I'd take some paracetamol, but nothing would change. I tried drinking more water and just resting in bed. They'd just kind of stay there, and they're like nothing I've ever experienced before. On top of that, I often get really nauseous as well. I've never actually thrown up, I only get the sensation, kind of like motion sickness.
Okay. These symptoms are quite common actually. Is there anything else?
Well, I've definitely put on some weight. I think it's about 5 kilograms. I just feel really bloated, and I mean, that's a lot to put on in a short time. Until recently, I also noticed some spotting, and it definitely wasn't my period. It just started happening at the oddest and most inconvenient times. But now, well, it's stopped altogether.
Okay.
That's why I'm really worried, because the truth is I sometimes forget to take the pill. If I forget, I try to take the second one on the same day, like my last doctor told me to do. But, well, a couple weeks ago I forgot 3 days in a row, and then I started taking the sugar pills by mistake. I just got so confused. Obviously my partner didn't know, so he didn't use a condom. Then once I remembered, I went to the pharmacy to get the morning after pill, but I think it might have been too late. I almost bought a pregnancy test at the same time, but I was feeling far too nervous then to even take it to the counter.
Okay, a blood test can confirm it, although this may take a couple of days to get the results. These days, a home pregnancy test is very accurate and you'll get the results far sooner, but confirmation is needed before making any changes to what you're taking now. Until then, I'd strongly advise using other forms of contraception.
Okay, but is it possible to have a urine test here in the clinic now? My friend had one of those, and I think I'd prefer it. Once I leave here, I might chicken out again, and I'd rather just know now.
Of course.
And also, I think regardless of the results, I should maybe go over all the information about the pill again with you, because I find it all a little confusing. If the result is negative, then I'd like to try again with a different brand and try to be a little more responsible with taking it. Maybe it would be a good idea to make a family appointment too, if you wouldn't mind. I think it would be good to bring my partner along so he can learn all about it too. And if the result is positive, well, it's a good chance to go through everything together.
I think that's a great idea on both accounts. I'll start by giving you... You hear a urologist talking to a patient named Mark Jenkins. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at your notes.
Hi, come in. It's Mr. Jenkins, right?
Yes, Mark's fine.
Sure. Now, Mark, you've been referred to me because you're suffering from urinary incontinence.
Yeah, that's right.
And you're 38 years of age?
Yes.
Okay, well, I have your GP's letter here, but I'd like you to tell me more about this. How long you've had the symptoms, how it's affecting your life, that type of thing.
Sure. Well, it's been going on now for about 2 months, actually. A little longer, I think. At first, I resisted going to see my doctor. I mean, I'm not that old yet and reasonably fit and healthy, and frankly, I was more than a little embarrassed. A guy my age doesn't usually expect to have the same issues as a man twice my age. But eventually it just became too much for me to take, and that's when I sought some advice. Sometimes I could feel it coming, but most of the time it was a sudden burst, so to speak.
Okay. Was there a particular trigger?
Basically what happened was I'd recently started a class of CrossFit training. I'm not sure if you're familiar with it, but it's all performed at a high intensity and crosses over various disciplines like weightlifting, rowing, gymnastic type movements, that sort of thing. Well, every time I went to class, I had this really heavy pressure on my bladder. Eventually, right in the middle of weight training, it became so strong that I had no control over it. It just leaked out while I was doing it. Later, I noticed that it had also come on if I had severe coughing fits.
That's understandable. And your doctor did some tests?
Yeah, so my GP's a great guy and he was really professional about it. I had a prostate exam, the results of which are apparently fine, and it's a normal size and everything. He also got me to keep what he called a bladder diary for a full day and night, which was fine. I recorded how often I went to the toilet normally and also the occasions that I didn't have control. I have all that here for you.
Right. That's certainly helpful. Look, you're obviously very fit, but could you tell me some more about your health, especially any past conditions, operations, or if you've ever smoked, that kind of thing?
Well, up until 5 years ago, I was quite heavy. I'm only 170 centimeters tall, and I used to weigh 135 kilograms, so that gives you some idea. I think my BMI was 46 or 47, so I was classified as obese. I haven't had any operations, but my GP at the time confirmed that I had pre-diabetes, which really scared me. I was a pack-a-day smoker, but usually more. I was also a heavy dope smoker, and I was in an office job. That's what caused me to overhaul my life, change to a very physical job, and get myself to the gym.
What do you do for a living now then, Mark?
I'm a roof tiler, so you can imagine what that's like, being on top of a 3-story building and suddenly needing to go. It's not an easy job to begin with, and this is making it 50 times worse.
And has it affected your social life at all?
Look, if I'm completely honest with you, my bladder seems to be controlling every aspect of my life. I know that sounds like an exaggeration, but that's how it feels to me. I've already lost a relationship over it, so now I'm single, but I'm still young enough to be out dating and all of that. But the fear that this condition has left me with means that I don't really meet friends very often. It's an enormous burden. I was stuck in a line at a bank the other day and had to leave with a very noticeable wet patch on my pants. I'm scared to leave my home.
It can be very burdensome, I know. The good thing is you've taken steps to fix it. So what I'll ask you to do now